Good evening, and thanks for joining our COVID-19 stats video for the CDC Week 48. My name is Sara, epidemiologist at the Jefferson County Health Department, and this report includes data from Sunday, November 22nd to Saturday, November 28th. As always, we will start with an overview of the weekly total COVID-19 surveillance report, which includes both the community-based cases as well as the long-term care facility cases. Cases last week were still quite high. We had a total of 1,365 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is now 11,948 cases as of Saturday, November 28th. We are reporting 103 COVID-19 associated deaths as of week 48 and 23 outbreaks in the long-term care facilities. Let's start by going through some of the details of our weekly cases. And first, looking at the table of confirmed and probable cases by week in Table 1, you'll see the number of weekly cases was slightly lower than that of week 47. In week 47, we had 1,388 cases, and in week 48 last week, we had 1,365 cases. Please keep in mind when you are going to look at any data from last week, whether it be from us or from any other data sources, there are going to be some lags from Thanksgiving. And as a reminder, this count does include both our PCR lab confirmed cases as well as those probable cases. That probable count does include those who receive a positive result from an antigen test, those rapid diagnostic tests, and also includes those who meet both clinical criteria and have an epidemiologic link to a positive case, but maybe they have not yet been tested, or maybe they have not received the results of their COVID-19 test yet. The next chart we will look at shows a breakdown of the daily case numbers and that 7-day rolling average of cases. The actual number of cases per day is seen as indicated by that dotted blue line, and that solid blue line is the 7-day rolling average. We have been experiencing some big fluctuations in the number of daily cases, which is also why that 7-day rolling average looks a bit jagged towards the right-hand side of your graph. Our 7-day rolling average as of this past Saturday was 195 cases per day. This means that the rolling average of cases per day per 100,000 residents is 86.67, which is well above that threshold for the red status. Our new cases per 100,000 per week is another indicator used to determine our color status, and that number was 606.67, which is also classified as red. Next, let's look at the overall age group data in Figure 4. The 40 to 49-year age group has the highest number of cumulative cases at 1,946. Close behind is the 50 to 59-year age group, who has a cumulative total of 1,908 cases. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are 103 reported deaths in our county, most of which have been in our 80-plus age group. We are now updating the fatality count each Wednesday, so you can find that updated information on our website and on our social media accounts. The cumulative fatality rate in Jefferson County is 0.86%. Missouri's fatality rate is 1.28%, and the fatality rate for the U.S. is currently 2%. These rates are continuing to get lower, which is encouraging because that does mean better patient care, but please remember that mortality is not the only measure of severity when it does come to this disease. Figure 6 shows the COVID-19 cases by sex. 54% of cases are reported in females, and 46% of cases are reported in males. Moving on to Figure 7, we have the COVID-19 PCR test results by week, as well as a visual of that percent positive rate. This data only includes those lab-confirmed PCR cases, so remember that this does not include the probables, the antibody-positive tests, or the antigen-positive tests. The percent positive is currently 32.9%, and when calculating that percent positive, we take the total number of positive tests over the total number of tests each week. This gives us a rate that is showing the percentage of all COVID-19 tests performed during the week that are actually positive. Table 3 shows the number of positive tests, negative tests, and that weekly percent positive rate. During week 48, we had 1,252 lab-confirmed PCR positive cases. And so far, we are reporting around 2,500 negatives for week 48 to give us that positivity rate of 32.9. I do expect that number of negative tests to increase as the week goes on. This is one of those numbers that is affected by the reporting delays. So as you can see from week 47, we had the most tests that we have ever reported for a total of 5,005 tests for the week, which is great because we definitely want to see more and more people getting tested in order to identify and isolate those positive cases. But even with that high number of negative tests from week 47, the percent positive is still very high at 25%. Table 4 details our COVID-19 cases by race and rate per 10,000. The white population in the community currently has the highest number of cases as well as the highest rate per 10,000 at 294.2. The Black and Asian populations in our community have a fairly high rate per 10,000 as well, with just over 200 each. For the zip code data this week, we are continuing to see the same areas with a high number of cumulative cases as well as active cases. The cumulative number of cases can be seen in blue, and those active cases in each area are shown in orange. The Arnold area 63010 has both the highest number of cumulative cases and active cases in the county. They have 1,935 cumulative cases and 662 active cases. Festus 63028 and Imperial 63052 both have a high number of cumulative cases as well as active cases at the moment as well. Both areas have over 1,600 cumulative cases and over 500 active cases at the moment. Next, let's review the weekly community-based surveillance report, which excludes the long-term care facilities. In Figure 1, we see the weekly case count excluding the long-term care facilities. And during week 48, 1,316 cases were community-based, which means only 49 of our cases this past week were found in the long-term care facilities. And those cases do come from both the residents and the staff. When we look at the age group data for our community-based cases, we can see that the majority of our community-based cases are coming from the 40 to 49-year age group. And it's actually the 20 to 29-year age group that has the highest rate per 10,000. Anytime we're referencing rates, it's because different groups may not have the same amount of people in their population. So it makes comparing the different groups a little more difficult. So with rates, we get a much more equal comparison. Figure 5 shows the fatalities and the fatality rate by age group for our community-based cases, excluding those long-term care facilities. 48 of the 103 deaths in our community were community-based. And this puts that fatality rate for Jefferson County, excluding the long-term care facilities, at 0.43%. Lastly, we will take a look at the current school-aged population data. And as of week 48, there have been a total of 1,658 lab-confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In Figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. And during week 48, there were 159 cases reported for the 0 to 19-year-olds. This total is less than the 205 cases that were reported in week 47, so it is good that we are seeing a decrease. In Figure 2, we have the cumulative cases and the active cases by zip code for our 0 to 19-year age group. Both Arnold and Imperial have over 70 active cases within the 0 to 19-year-olds right now. These two areas also have the highest number of cumulative cases. Moving on to the 7-day rolling average of cases in Figure 8, the 4 different colors reflect 4 different age-based grade levels: pre-K, elementary school, middle school, and high school. The high school age students are shown in yellow, and they have the highest amount of daily cases when we use that 7-day rolling average of cases. But looking closely at each line towards the end of your graph, all of the groups are showing a decrease, some greater than others, but an overall decrease nonetheless. And lastly, I would like to continue to encourage everyone to follow along with the St. Louis Pandemic Task Force for information regarding our local hospital systems. Jefferson County residents are included in those reports. And the overview of this data is extremely important because it does give us an idea of our local hospital's resource availability. Let's all please work together to get those cases down, not only for ourselves, for our family members, but also for that hospital staff as well. Once again, thank you all for listening in and watching our stats report this evening. Please be sure to refer back to our website, jeffcohealth.org, for more details and recommendations on COVID-19. Leave us any questions that you may have in the comments or reach out to us via direct message, and have a safe and healthy rest of your week.